And all right. Let's go ahead and let's call this meeting to order. This is the Oregon Educators Benefits Board. Today is June 3rd. Oh, got the memo. It's June 3rd, 2025. And the time is 1:00 p.m. We'll do a quick roll call here. Enrique, are you with us?
Here.
Thank you. Cheryl.
Here.
Thank you. Michelle.
Here.
I thought I saw her. Oh, there you are. Thank you. Sally. Sally. Don't see her under the D's. Dr. Laura.
Here.
Bonnie. We have a Bonnie. Don't see.
Yes, Bonnie's here.
Oh, Bonnie's here. Okay.
Sorry. Turn the mic on, I know.
I know Tony said he was going to be late, but I'll ask anyways. Tony, are you on? Don't see him. Susan? Susan with us? Don't see her yet. Misty is going to be an excused absent, and Robert.
Here.
Okay, so 1, 2, 3, 4, 5,
Sally's
6,
here.
7. Sorry, say again. Oh, Sally. Thank
Sally,
you, Sally. Yep. All right, so we have 8 out of 11. That makes a quorum. So we are underway. Again, I believe Tony is going to hopefully join late. And Susan Miller is the only one that I didn't hear from. We'll just watch for her. Okay, first up on the agenda is to do the minutes from the May 6th board meeting. As everyone had a chance to scan through those. Any comments? No comments. I'll take a motion.
I move to approve.
Bonnie moves. Do I have a second?
This is Cheryl. I'll second.
Cheryl seconds. All right. Any questions? Seeing none. All in favor, say aye.
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 All right. Is there anyone opposed? Okay. Hearing no opposition, that passes. All right. First up on the agenda is the standard annual report. Back again. David.
Yes, thanks everybody. Great. Hey, thanks everyone for having me. I'm David Scarce, National Account Consultant with the Standard, and today joining me is Beth Rourke, our Disability and Productivity Consultant with our Workplace Possibilities program, and we're going to be reviewing the 2023-2024 plan year results for the life and disability plans. Next slide, please. So we will be covering plan enrollment history, the short-term and long-term disability trends, your life insurance experience, your workplace possibilities program results, including a few case studies, and then wrap up with some key observations and just a reminder of those value-added services and what's next with the standard. Next slide, please. And one more. Great. So looking back over the last 5 years, we've seen pretty steady enrollment growth in most products, with the exception of the voluntary long-term disability and the mandatory short-term disability. Both of those shows decline in the current year, the 2024-2025 plan year. And I think, a lot of that has to do with the offerings that are out there and how Paid Leave Oregon has had an impact on short-term disability. Next slide, please. But really, when you compare the current year with the enrollments over the last 5 years, we've seen some very significant gains in enrollment. And overall, between, looking back where we were in the 2020 plan year and where we are now, we've seen a 15% increase. The notable exception is that mandatory short-term disability, and that outcome was anticipated because of Paid Leave Oregon. There was the value of the short-term disability plan and having employers pay for that was less, and so we expected to see that reduce, and it certainly did. 73% reduction, in fact. But overall, when we look at the most recent plan year, we're seeing an annual enrollment growth of 2.5%, which aligns with our target growth goal of 2 to 3% annually. And so we're continuing to experience that, which is fantastic news. Next slide. And then one more. All right, so looking at the short-term disability trends, one of the immediate results that jumped out, and kind of sound like a broken record here, was the decrease in claims, kind of going with that reduction in the enrollment. We saw a 32% reduction in claims approved, and this, we believe, is a direct correlation to the Paid Leave Oregon plan. The number of covered lives for short-term disability reduced by 2,000 lives. And we also saw a pretty significant drop, obviously, in the payment. When you look at 2023, where we have 1.3 million in benefits being paid out, to 2024, where it dropped to 400,000. And the reason for that is the members' entitlement to Paid Leave Oregon means that the benefits for short-term disability get reduced by that entitlement. So rather than receiving a $1,500 a week benefit under short-term disability, these folks now get $15, which is the minimum benefit paid on the plan, because under all circumstances, members are actually going to be receiving a greater benefit under Paid Leave Oregon than they would be receiving under the short-term disability plan. Next slide, please.
Looks like we're getting an error
Yeah.
box.
I have no idea what's happening here. David, can you share your slides
Yeah, let me hold
while
on
I
here.
figure this out?
Yeah, let me pull it up real quick. Sorry about that.
Okay. I'm
Just
gonna
take a
stop.
second. I should have been prepared for this. Okay. All righty. Actually, let me get caught up to where we were here. There we go. All right. Okay. I think that's where we wanted to be. So, looking at the specific reasons, for claims, the top two diagnostic categories were maternity and musculoskeletal. And these results aren't surprising. This is what we expect to see when you're talking about short-term disability plans. Maternity is always kind of your top vote getter, so to speak, and then followed closely behind by musculoskeletal. So nothing surprising there. When we kind of drill down into the diagnoses, though, one of the things that we're looking at over the last 5 years is we're seeing a slight actual reduction in the maternity claims. Compared to a percentage of claims filed in 2024, if you look at that, you can see that the reduction was 35% of claims in 23 were maternity, and that's dropped down to 28% in 2024. But we have been seeing, a kind of continued increase in musculoskeletal claims over the last 5 years, where in 2020 it was only 14% of claims, but now in 2024 it's representing 25% of claims. And this is kind of a continued theme that we're also seeing into the long-term disability claims, and I'll talk a little bit more about that once I get into the LTD portion of it. But that's what we're seeing happening with short-term disability right now. Again, nothing real surprising, no trends that are jumping out at us, other than we're seeing an uptick in the musculoskeletal and a slight reduction in maternity. So getting into the long-term disability claims, when we're looking at that, we're seeing that similar reduction in claims for 2024. But with long-term disability, it's a little bit different because long-term disability plan has a pretty long benefit waiting period. So whether it's a 90-day benefit waiting period, and so there's a lot of these claims that we may not see yet. When we're seeing that reduction in people filing claims for short-term disability because of paid leave Oregon, they may not always be timely then in filing their claim for long-term disability with us. So there's always going to be some outlier claims. And this is kind of a similar trend that we saw when we did the review last year. We saw a kind of a low number of claims when we were doing this annual report, but yet by now, now when I run this report, you can see in 2023, the claims actually ended up being higher than 22 or 21. So I would expect the 2024, that trend to continue in 2024, and we'll end up seeing a little more normalized year where we're seeing around 170 to 180 claims. And then from a payment perspective, again, it's pretty consistent in between that $7 to $8 million range of benefits paid. And this is what I was talking about, where we kind of drill down into the diagnoses. When you're looking at this over the last 5 years, one of the things that kind of jumped out at me was that we're actually seeing a bit of reduction in cancer claims. Although your cancer claims are still by far the highest number of claims that you receive, we're seeing a slight reduction, in the percentage of claims being reported for 2024, down to just 14% of the claims. But we're we're continuing to see that increase in the musculoskeletal claims. And so you can see, if you go across that line there where it shows it by year, you can see that we started off 15% of the claims were musculoskeletal. Well, now we're up to 32% of the claims were musculoskeletal. And so, seeing just essentially almost a 10% jump from 23 to 24. And so I kind of dug into that a little more closely to see what types of claims that we're seeing. And a quarter of those claims, 25% of those claims, are related to joint disorders, another 18% osteoarthritis conditions, and then 15% to those back disorder claims. But I guess one positive note about that is, although that we're seeing a rise in musculoskeletal claims, our Workplace Possibilities program can have the biggest impact on claims of these types of diagnoses. And so we'll talk more about that later when Beth reviews the results of the program. But while on the surface, this might be a little bit of a concerning trend, I think that with our Workplace Possibilities, we can have a pretty positive impact on these claims. So now I'm going to jump into the life insurance. We saw a pretty actually substantial increase this last year in life insurance claims, a 15% increase in death claims for members, and a 65% increase in the actual claim payments. So you can see there that in 2023, there were 58 claims. In 24, it jumped to 67. And the dollar amounts went from 4.7 million in 2023 up to almost 8 million, 7.9 million for 2024. When looking at your top diagnostic categories, really nothing's changed here. You've got cancer, you've got your circulatory claims, which are, basically your heart disease claims, and then you've got your accident claims. So not a whole lot's changed there, just more claims, unfortunately, with higher payouts. And then kind of looking at this a little more closely by diagnostic category, first, we saw, a pretty substantial reduction in benefits paid for the cancer claims. Last year, 50% of the benefits being paid out were to cancer claims, and this year that's dropped down to 25%. And the second item that jumped out was the substantial jump in accident claims from 11% of the claims last year up to 32% this year. And so that's meaning that, unfortunately, more people are dying from accidents than they have in the past, and that these people are actually covered at a higher rate. So I guess good for the family, not so great for the member, but at least that there's some protection there for the families. Any questions about that? I kind of went through that pretty quickly. I'm going to turn it over to Beth dig into the Workplace Possibilities Program and the results if not. All right, hearing none.
Thanks,
Beth,
David.
I'm going to let you go ahead and talk about our Workplace Possibilities Program.
Great. Something I love to talk about. So when we talk about workplace possibilities, there's two type of support we provide to OEBB employees. There's return to work support. So we look at all newly approved short-term disability claims and we reach out to employees to provide return to work assistance. I'll also talk a little bit more about our stay at work or our claim prevention in a couple of slides. But basically for the past 2 years, we've had 122 referrals, 43 successes on the return to work side, which means we save 586 days of disability and almost $20,000 in a benefit savings. We also did 105 stay at work claims, so I'll talk a little bit more about that. I'll have you go to my next slide. And this just breaks down some of the net savings versus the actual savings when we talk about that. So on the return to work side, our estimated benefits and cost, if we look at those dollars, we saved about $36,000. With 105 stay at work claims, we have spent money to prevent claims. You'll see those dollars adjusted there for net savings. And these numbers will vary a bit year from year. When I look at the detail of the years, we're always going to see a variance in how many days saved. If we can save disability days, that's obviously always the goal, but sometimes the numbers, we don't save as many days, but we do believe spending that money for employee outreach, support to employees, and accommodative equipment is really important to continue that support. So we do think this is a really important benefit for your employees. So we can look at those cost savings. And on the next slide, we'll look at those stay at work cost savings too. And Stay at Work is a great program. We work specifically with directly with employers and with their HR departments, and they're able to refer employees even before a claim or a disability or a leave has been filed. We can get involved with these employees. We provide professional case management services, potentially adaptive equipment that will prevent a claim or a leave from happening. So we've had 105 successful Stay at Work claims, which is a great benefit and a great number. If we look at your STD durations and average weekly benefits, we estimate we've saved over $228,000 in claim savings. So it's a really important benefit and program for your employees. And as David was saying, with those musculoskeletal claims, that's really where we have the impact, and that's where we can really make a great impact. Those employees with those musculoskeletal conditions, those back conditions at work, we can really proactively intervene and prevent them from going out on those claims. So I think that's a really important thing to consider when we look at those rising numbers, as David said, on the LTD side.
Yeah, and I would just say, and Beth, you kind of read my mind there, but I would just say, with these folks that are already out on disability claims, we can still have the same impact with them as we would with the Stay at Work, where we can work with these employees, with their school districts on some type of accommodation that might be able to get them back to work. And, that can be something pretty simple, or that can be something pretty involved. And the nice part about the long-term disability plan that you have a $25,000 reasonable accommodation expense benefit, which gives us up to $25,000 to spend on accommodations to get folks back to work. So we really have endless possibilities when it comes to seeing what we can do to get someone back at work.
And I have a couple examples we've pulled about some of the work we've done. One of our return to work cases, we helped a project coordinator. She did have knee surgery. She was out of work, and she really needed something. She couldn't sit at her desk all day when she returned to work, so she needed some active motion at her desk. And so we purchased a pedal footrest for her. And one of our case managers worked with the employee and also facilitated a hybrid schedule so she can do some work from home and some in the office. So she was able to attend physical therapy, continue with her recovery, and it allowed her to go back about a week earlier than expected with that hybrid work schedule. So that was really helpful with knee stiffness for her. And then our next case study talks a little bit more about a stay-at-work case. This was a claim prevention case. And we get a lot of questions. How do we help someone who might have a diagnosis like ADHD? And workplace can be very successful with these types of diagnoses. So someone who had concentration issues, focus and concentration issues when they were physically uncomfortable in the office. More so when they were sitting and just doing some static sitting. So we were able to provide the employee an adjustable height sit-stand desk. So it allowed that employee to stay focused and attentive and change positions. But we also provided a leaning stool that she could lean on when she was using that standing desk to keep her active in the workplace. So we spent about $2,200. And the employees' focus and attention really increased with these active workstation modifications we made. And the employee was very appreciative, especially with the chair that allowed her to keep her focus and concentration. So when thinking, I know we think a lot about musculoskeletal, but there's a lot we can do on the behavioral health, and especially with some of these neurodivergence diagnoses. Those are also things that we can have a big impact on.
And I would just kind of as a refresher to everybody, the way Workplace Possibilities is available to anyone who is enrolled in the long-term disability plan. So when you have employees that are enrolled in long-term disability, they have access to our Workplace Possibilities program for these accommodations. And, you know, whether it's the stay at work or the return to work, if they are enrolled in that coverage, they have access to this program. Any questions about Workplace? All right, hearing none.
I do.
Oh, go ahead,
Sorry.
Sally.
It does. Okay, so how does an employee access the workplace
Possibilities?
Is that initiated by like the ADA coordinator at their district, or do they reach out to you guys for that, and then you guys work with the?
It can happen any of those ways. Sometimes we already have a relationship with either the ADA department with an employer or the HR department, so they will reach out to us and start the process. But employees also reach out to us directly, and we can provide that. And like I said, we do have that proactive review of short-term disability claims. So we do proactively do outreach when folks are out on claim to provide them that support.
Okay.
Yeah, and Sally, we have a, we've got a microsite that that we put together for OEBB that captures all the information about the life and disability plans that Standard offers, and there is some information in there about Workplace Possibilities. So if an employee is looking in there and they see the flyer on Workplace Possibilities, it says, "Hey, here's a phone number you can call if you want to try to talk with us about perhaps helping you with an accommodation." So there is information out there, but certainly if an employer sees someone struggling, and the employee may not recognize it, but the employer certainly can recognize, some of these things that are going on, they can always reach out to us, and then we can do the outreach to the employee.
Okay, thank you.
Yep. Great. So some key observations. We're continuing to see that steady enrollment gains over the last 5 years. The STD claim incidents and benefit payments have declined significantly since the introduction of Paid Leave Oregon. The STD incidents for musculoskeletal are slightly higher than benchmarks, but we've seen some steady increases over the last 3 years, but again, nothing that's too concerning. LTD incidence rates have remained lower than benchmarks. With the musculoskeletal has been running higher than benchmarks, but again, with our Workplace Possibilities, we think we will be able to have some impact on those claims. The life insurance claims is really where we saw the biggest kind of change year over year, where we saw a pretty substantial jump in the number of claims received and the payments that we made. And then lastly, we're seeing some great results with that Workplace Possibilities program and the stay at work that Beth was talking about there. And just real quickly, just in closing here, just to remind you of some of the things that I talked about the last time I was here was, the travel assistance. Anybody that's enrolled in life insurance, whether it's the basic life plan or the optional life plan, they have access to travel assistance. Anytime a member or their family member is traveling more than 100 miles from home, they have access to these services. We also have our life services toolkit, which has services available to the members, whether that's that financial planning where they can create their own will online at no charge, as well as a suite of services available to the beneficiary should the member pass away, from grief counseling to legal services to financial counseling, again, all available at no cost, simply because the member's enrolled in life insurance. And then I also mentioned last time about our two-way texting program that went live as of January. We're continuing to see great success and a lot of adaptation to that. Cheryl, you have a question?
I'm sorry to interrupt, but
Nope.
question for the people who are covered because the count or their entity pays for amount of life insurance. So this isn't for like the extra life insurance, correct? This would be for anybody that's getting
This
base
is,
life
yeah.
insurance
So
coverage.
whether the school district or entity is paying for basic life or not, as long as the employee has basic life. So whether that's optional life
Okay.
or basic life, they have
Okay.
access to this. Yeah.
Cool.
So
That's great news. Thank you.
yeah.
I
So
was not
really,
aware of this.
the majority of OEB members are going to have access to this because the majority of them will have some form of life insurance.
Yeah. Honest. Thank you so much. This is great news.
Yeah. Yeah. You bet. But yeah, so the two-way texting is we're seeing a lot of adaptation to that. It's just another way to connect with us rather than calling the toll-free number we have for OEB. Members can just text that number with their questions, their inquiries, and get the same level of response that they would through the call center. It's manned by people. It's not bots or AI. It's actual people responding back to them. And then the enhancements with the portal where employees can file online, upload documents, see status. We've had a lot, some significant improvements with our portal for the employee side, as well as the employer side. We've really revamped what we're showing to the employer now. And I think that the best thing about what we're doing with the employer is really this customizable self-service reporting. They had reporting available before, but what they can do now is so much better. They can create their own reports. They can select the data elements they want to see. They can save the reports as favorites for recall at any time. So it allows these folks to be able to really get in and dig in and see what's going on with the life and disability claims. And then lastly, we got a lot going on. Like I said, we're pretty excited about where this is going. We're continuing to, move forward with enhancements with our data feeds, with the AI-powered claim assistance. And so we're really seeing some great results with that and continue to work on that as we go through the remainder of the year and into 2026. Christy, looks like you have a question.
I do. Hi, David. I
Hey
was
there.
curious if you could provide us any updates on language availability for like the portal, member communications, and texting.
From a texting standpoint, texting right now is available in English and Spanish. And we will be adding other languages to that later in the year. From a portal perspective, it is adaptable. So if you did a Google Translate, you would be able to translate it to Spanish, but the portal itself is in English. And I'm not sure where we stand with that as far as where that is in the forecast for making sure that it's got Spanish language available. But right now, I know that it is compliant with, like a Google Translate, which would translate the whole portal into Spanish, for example. That's available now. And then as far as materials are concerned, any of I guess depending on what you might want from a printed material standpoint, claim forms or things like that, we have those available in English and Spanish. If anybody's ever reaching out to Standard through our contact center, there's English and Spanish available immediately, as well as language lines to help us translate anybody else that might be calling in with a different language.
Thank you.
Does that help?
Yeah, I just was, the board has talked a lot about having English and Spanish as a minimum language basis. And so I just wanted to see where the standard was at with that at this time.
Yeah, we're definitely moving in that direction. I think the release of the updated portal in English first was, that was the thing we wanted to get out right away, and we'll, continue to see improvements on that. And I will follow up with our IT folks to see kind of where we are in the pipeline with that. And, is this something as simple as a toggle switch that switches it from English to Spanish? I don't know. I'll have to find out.
Okay. Yeah. And
Yeah.
I mean, obviously roadmap, we'd love to see localized Spanish language as an option for the website.
Yeah. Yep. Absolutely.
Thank you.
Yeah, you bet. That's all I had today. And it looks like I'm bumping right up on my time. So
Yep.
Any other questions?
Very good. Any last questions from board members? Rose, how are you back at getting your slides running again? Sally, question.
We'll find out.
Yeah, and I apologize if you already said this. Are there printable materials online that we can print for our employee groups?
Yes.
Okay. Thank you.
Okay. Hold that thought. Okay, so we're coming up now on Garner implementation update from Mercer. Yep, there we are. So Kirsten and John, are you ready?
We are ready.
All right, take it away.
Okay, I'll be presenting the first part here. So next slide, please. Next slide. Okay, so what we're going to cover today, good afternoon, board members. Again, happy June. I can't believe we're already halfway through the year. In terms of today's update, we're going to cover three things. First, a brief recap of the why, what, and the how of Garner. Then we'll provide an implementation update, including communications, entity engagement, and MODA integration with Garner. And then thirdly, we'll review coordination between the accounts, which is a question that had come up on the last board meeting. So first, we're going to start with this slide, which is a bit of a reminder of the, why the board decided to proceed with Garner. What you see here is Garner represents that efficiency piece in the balanced approach. And as you can see here, it's about almost, a fifth of the savings that was needed to get to the 3.4% increase was coming from Garner and the efficiency piece. So the other thought that we wanted to leave with you here is with, if there hadn't been this Garner change, and if you had looked at the additional plan design changes that would have to be made, that would be another $10 in the office visit copay. So I think that kind of helps you understand, by doing Garner, you avoided having to do another $10 office copay change, or an additional $10 or subsidy. And as you'll remember, the goal was not to go too deep into using subsidy, because that always has to get paid back in subsequent renewals. So just a quick reminder there. If there are no questions, we'll move along. So that's about the why the board proceeded with Garner, or one of the reasons why. So just a couple reminders of how this works. Again, Garner only applies to members enrolled in MODA plans. At its essence, Garner is an optional program that offers employees an incentive to use high quality, cost-effective providers that Garner calls top providers. And the incentive involves the reimbursement of member out-of-pocket expenses. So this includes deductibles, copays, co-insurance, and this reimbursement is tied to the use of top providers. And there's an annual limit of $700 for individuals and $1,400 for families. And these limits were set purposely to help mitigate some of the plan design changes that were made to achieve the state mandated 3.4% increase in renewals. So I think it's important to remember that this is optional. Members who choose not to use top providers still receive the same MODA benefits, but no reimbursement for their out-of-pocket expenses. Garner identifies the top providers within the MODA network. So top providers are inherently part of the MODA network and our network providers. I think the other thing to think about too is really to that Garner is providing an additional layer of transparency for members to find high quality providers that are expected to yield better outcomes. So I think that that's one of the other pluses here. And I think the other thing, looking longer term, should the board decide to continue with Garner in future years, that you have an impact that goes beyond this renewal. So typically, there's a roughly, in the 18% range of using the top providers versus not using top providers. So what Garner is doing is, providing some of that savings back to members. And to the extent that people get into the habit of using top providers, there's a real ability to bend trend here going forward, which would reduce the need for potential plan design changes in the future. Okay, next slide, please. And I'm going to cover these slides fairly fast because you've seen them before, but I think it's important to kind of recap these, just as, so we all have a common going, starting off place. So about the member experience, Garner is purposely designed to be easy for members to use. Step one is really looking for a top provider. You can do that in the Garner app, or you can contact concierge support and find that top provider. And then step two is, visiting that top provider and paying the applicable cost share at the point of service for obviously for covered services. And then, a large part of steps 2, 3, and 4 are kind of transparent to the member. One other point that I would make about step 2, it's not just the visit to the top provider. It's also if that top provider refers you or orders, some tests or, some prescriptions, those are also reimbursable under Garner. Step 3, again, this is happening in the background. The member's not involved. The provider bills MODA as usual. And then MODA sends, once MODA processes the claim, MODA sends that claims feed to Garner, and then Garner uses that information to reimburse the member for their cost share amount. And then getting to step 4, so this is kind of, a lot of this is happening automatically in the background. Garner reimburses the member for their out-of-pocket costs up to that annual limit that we talked about. And then, once members register, which can occur during open enrollment for Garner, they can set up direct deposit if they don't want to receive a check. So that's, this is kind of how it works from a member perspective in a nutshell. Okay, if there are no questions, I'll move to the next slide. And again, this is really just a little bit more about the member incentive. And again, this was something that the member incentive was designed to help mitigate some of the plan design changes, either fully or partially mitigating those. As you can see, as this compares to the increases in the MODA deductibles, so the $700 more than covers that increase in deductible, and it also, covers most of the increase in the out-of-pocket maximum. And again, how this is going to impact members really depends on, the providers they use and, if they're using top providers or not and things like that. So people could end up with having lower out-of-pocket costs in this upcoming plan year than in prior plan years, depending if they use top providers and the types of services they're using. Okay, we'll keep moving. So now we're going to move into the implementation updates. Next slide, please. And again, just want to emphasize that there are a lot of joint efforts between OEBB, MODA, Garner, and Mercer around the communications, because early and ongoing and comprehensive communications are going to be key to the successful implementation of Garner. So here you have some of the types of communications that are being worked upon. These include emails, mailers, pre-recorded open enrollment webinars. Attendance both by MODA and Garner will also be attending some of the benefit fairs for open enrollment, and then also presentations during in-service days. So these are some of those communication modalities that are being employed. And then if we look at the right-hand side, you can see some of the things that MODA is working on, here as well. Again, there's the entity brochure, and this is really kind of key in communicating the upcoming changes for the plan year. In addition to that, there's the program guide that MODA is updating, and this program guide is a listing of the point solutions that are available to our members, and will also include Garner. And that's something, these program guides are something that can, back to one of the questions that we had most recently is, some of these brochures can be ordered in terms of printed materials for distribution to members, both at open enrollment and throughout the plan year. So this kind of gives you some of the communications updates. Then moving to the next slide, not seeing any questions, so we'll keep moving. On the next slide, I just want to say that while Mercer is presenting this implementation update, we want to acknowledge that the heavy lifting is being performed by MODA and Garner, and we very much appreciate their efforts. So just want to be clear where a lot of the heavy lifting is taking place, and I think this is a good example here. And so in May, you see several things that MODA has done. MODA routinely does this for OEB each year in terms of rolling out the plan changes for the upcoming plan year. Again, they've already met with 90 plus, HR, administrators, business managers, superintendents, and union representatives. And again, the purpose of these meetings is really to help these people understand what's changing, and also, get some thoughts in terms of what they need in terms of open enrollment support. Also in May, MODA has reached out to all entities to understand what kind of support they would like during the open enrollment benefit fairs and also the in-service days. And MODA has already received over 50 requests in these areas in terms of support for OE and support for the benefit fairs. Upcoming in June, so in this month, MODA will be attending COSA, and my understanding that Garner might also be attending COSA with MODA. There's also the Oregon Association of School Business Officials meeting, and so these are kind of some key meetings, and this is good forums for both MODA and Garner information to be disseminated at. You also see here, MODA and Garner are also working to develop train the trainer resources, which will be helpful to support the entities as they support their employees. Moving over to the rightmost column. Oh, Ali, would you like to jump in?
Yeah, I just wanted to add that OEB staff will also be at COSA and WASPO as well. Thanks.
Thanks, Ali, and pardon my ignorance of OEB's attendance. I apologize.
Yeah, no worries. Yeah.
In terms of entity feedback, so these, all this outreach that MODA has done has been a really good venue for getting feedback from the entities, and the feedback about Garner has generally been positive. And I think they understand that it's another important tool to help members offset some of those benefit changes. There are concerns, in terms of, members understanding how to use the benefit. So again, this goes back to communication, early and often, and comprehensive. And then there's also particular concerns in rural areas around the availability of Garner top providers. This will be able to be addressed in the August timeframe, as the Garner app will be available to members at that point, to have a better understanding of the availability of top providers in their area. I'm going to pause there for any questions. Okay, well, we'll move on to the next. This is also another implementation update, and this is regards to Moda's integration with Garner, and Moda is making a special effort to create a seamless experience for members, and this includes creating links between the Garner and the Moda member dashboard. So the thing is, you can just kind of click on a link and get over to Garner. The other thing too is implementing a single sign-on. So this would allow members who are already signed on to Moda to not have to separately log on to Garner. So essentially, this would allow them to just log on to the Moda and then be able to go over to their Garner account. Moda is also updating the OEB specific website to include Garner information that can be used both by members and by entities. And then finally, Moda and Garner are collaborating to develop protocols for those warm transfers between the Moda Health Navigators and the Garner Concierge teams, so that becomes more of a seamless member experience. Okay, so now we're going to get into the section about the account coordination. And so at last month's board meeting, so next slide, please. At last month's board meeting, a question arose about the coordination of the alphabet soup of of accounts. These include the flexible spending account, or FSA, health reimbursement arrangement, or HRA, and the health savings account, and HSA. And by its nature, this conversation will be maybe somewhat technical, and just want to give you a forewarning about that as we get going here. As we embark on this discussion, it's important to remember that the coordination between these accounts takes place today, because all of these accounts are currently available to members. Yeah, okay. I was just looking, Cindy, at your message. I was thinking, okay, yep. So, okay, so let's dive into this. So these accounts and this coordination already takes place today. And this purpose of this slide is not to provide a comprehensive listing of all the characteristics of these accounts, but rather to highlight some of the key differences that are relevant to this discussion. First of all, let's start with the FSA. And the FSA is typically employee funded in almost all circumstances. And it has a use it or lose it provision because of its tax preferred nature, and annual contribution limits are set by the IRS. And then moving on to the HRA, this is employer funded. It's not portable like the HSA is. There are no limits. And actually, Garner is another HRA. So technically, Garner is another HRA than the one that you might be receiving from your entity already. And then we get to the HSA, and this is really kind of a more unique arrangement. And this can be employee or employer funded. The employee must be enrolled in a high deductible health plan. So for Moda, this is plans 6 and 7. And the other thing to remember about HSAs is that you can't have an HSA and a general FSA. These are kind of incompatible. And the HSA is portable. The employee owns that account, and annual contribution limits are set by the IRS. Okay. So I'm assuming everybody's with me so far, so I'll go on to the next slide. And some of this information has already been communicated as part of MODA's, outreach efforts. So some of this information has already been come up in conversations with the entities. So and as we noted previously, the coordination between these accounts already occurs today because they're already available. I think now for some key points. Because entities, not OEB, directly administers these accounts, coordination falls to the employees. So just to be clear, these accounts are not administered through OEB. They're administered between the entities and the administrators of the account. So because of this, the coordination falls to the employee, and this makes employee communications key. And there's a robust effort underway to develop communications about how these accounts work together. There's a fundamental message for employees, and that's no different from the message that they have today, that employees need to avoid double dipping, which violates IRS rules by seeking reimbursement for the same out-of-pocket expense from multiple accounts. So this is kind of like the fundamental message for employees is really avoid double dipping. Another kind of basic rule is that Garner typically pays first because the reimbursement is automatic if top providers are used. The one exception for this involves HSAs, because when you have an HSA, the IRS minimum annual deductible must be met before Garner kicks in. And again, this is all conditional on people using top providers. So, just want to reemphasize that one, there's an exception around the minimum IRS minimum annual deductible. And so that has to be met before Garner can kick in. And that's, part of those rules around having high deductible health plans. Okay, so if there are no questions, let's move to the next slide. And the goal of the next slide is to provide a picture that hopefully makes this more intuitive now that you have some of the background, or not. So this chart's really designed to be read from the bottom up, because essentially the first thing that you're going to meet is your deductible. And, so if you look on the far left, you have your deductible, which is part of that out-of-pocket max, but just really say, so you're starting at the bottom and working up. And it's going to be different because of the different accounts that you can have with MODA's plan 1 through 5, which are not, these are not high deductible health plans, while MODA plans 6 and 7 are high deductible health plans. So you'll notice that there are different accounts available, and there's different sequencing in terms of how this works. So let's get into it. So let's start with MODA plans 1 through 5. So again, here what you can see is that Garner could be used to reimburse part or all of your deductible. And again, remember there's those annual limits of the incentive, which is $700 individual, $1,400 for family. And then once that Garner incentive is exhausted, the next item that you would want to spend is that employee funded FSA. And the reason for that is it's employee funded and it's use it or lose it. So essentially, if you don't use that up, under the IRS rules, lose it. Typically employers will have a rollover, as maybe a few months into the subsequent plan year. But anyway, essentially it's use it or lose it. So you want to use those monies first after you've exhausted your Garner incentive. And then if you go through your flexible spending account, then if you have an employer provided, if your entity provides you with an HRA, that would be the time that you would want to use that. And then you may or may not have remaining out of pocket, depending on which plan you're on after that. So that's how this works in terms of MODA's plans 1 through 5. And I'm going to just pause there to see if there are any questions. And then let's look at MOTA plans 6 and 7. And again, just as a reminder, these are high deductible health plans. And if you have a high deductible health plan, you can have an HSA. Those are the rules. And one other, I'll come back to something at the end, but there was one other point I wanted to make on plans 1 through 5, but I'll come back. So when you have an HDHP, high deductible health plan, you cannot have a general FSA, and that's why you don't see any green on the right-hand side. The other thing too, and again, then you have this IRS minimum deductible that has to be met before Garner kicks in. So just to help you understand how much that is this year, and it will be for next year for OEB, is $1,650 for the individual and $3,300 for the family. So this is the deductible that has to be met before Garner can kick in. So, and in terms of meeting that deductible, members can either use, just pay it out of pocket, or they can use the HSA to help them meet that deductible. Once that minimum deductible is met, then Garner kicks in automatically if they're using top providers. After the Garner incentive is exhausted, then the thought would be, members would probably want to use their HRA as a next, their employer entity provided HRA as the next source of reimbursement for out-of-pocket monies. And then if they go through that, then they might, they would have that, the ability to, to use the HSA again. Again, the key point here is you're not using more than one of these funds at a time, that you're using these, in some kind of sequence. The one other comment about HSAs is members may not choose to use their HSAs either to meet the IRS minimum annual deductible or after they've exhausted both Garner and their HRA from their employer. Because a lot of employees are using these as a vehicle to kind of save and invest for retirement. So again, if that's how they're using, because it's, again, these are on a pre-tax basis, and, as is the growth, and then it can be used on a pre-tax basis if you're using it for healthcare expenditures, that they might use this as a vehicle for retirement savings. So that's, I think that's the story around plans 6 and 7. If I may return to plans 1 through 5, I think there's a key thing in terms of open enrollment. So people might want to better understand if they plan to use Garner. So say that they wanted to have typically they put $1,000 in their FSA. Well, with Garner, if you intend to use top providers, when it comes to open enrollment, you might want to think, oh, I don't want to put the full 1,000 in there necessarily, because if that's what you think your out-of-pocket costs are going to be, you can kind of back that down to 300 potentially, because Garner's kicking in 700 if you're individual. So hopefully, the thing is, part of the communications will also encourage members to think through, how much they put in their FSA in the context of the availability of the Garner incentive. So, and that concludes the Garner update, and hopefully this addresses some of the questions, the excellent questions that were raised in the last meeting. Again, if you have questions that arise after the fact, after you have a chance to absorb the material a little bit, feel free to reach out. We're glad to hear what those questions are and respond to them. Thank you for your time.
Thanks, John. We'll go to the next slide, please. Thanks, Rose. John and I wanted to take this opportunity to thank all of you for sharing your time and energy with us over the last year. We wish you all a fun and restful summer, and we look forward to seeing you in September, which is going to come much faster, I think, than maybe we'd like. But as we think about what we're going to work on next year together, we just wanted to touch on a couple things and acknowledge that we have some priorities with you for next year as we work together to craft a 2026-27 renewal strategy that achieves OEB's goals and also revisits some of the key priorities that we've had now for a few years. Some of the items on our list to talk about with you include pursuing negotiations and innovations with our carrier and vendor partners to avoid further plan design changes for 26-27. We want to revisit your board priorities, which we know include family building benefits. We want to work on increasing member engagement in the broad portfolio of really excellent programs that we have in place. We want to continue to work to increase our member education and understanding of the services that are available. And then we know one of our OEB goals is to explore the value of an RFP. And so you'll be hearing more about that as we work with you next year. So thank you and take care. We'll see you soon.
Okay, any questions or comments from the board on the Garner implementation update? I think we were asking them as we went along fairly well. Okay, let me pull up my next on the agenda is the CO update from this morning from me. We're going to just review that. So we covered 3 items this morning. In the first thing was covering the dental performance measures, primarily based around preventative services. 3 dental carriers, Moda Delta Dental presented first, and they were pretty solid with the metrics, going through all the members. They continuously enroll close to 190,000 between OEB and PEB people, or total continuous enrollment. The overall performance numbers were nominal, some ranging up year over year as high as a 3.5% change, and as little as no change in work divvied up in the presenters, all except for Lamet, presented in the rural and disaggregated data, although a request was made to get more details on the disaggregation by cultural background and ethnicity. So, but overall, the numbers were there. The primary decision that was made after the data was presented was for this year, current year. Basically, last year we made some changes in the quality metrics that were happening for dental, and of course that's not presented because this year's still going. It ends in a couple weeks, so that data with the changes will be presented next year. So what we had to do in CIA was give the approval to continue the changed metrics for next year's plan year. So we'll review this year's plan new metrics next year, but we'll continue with the current changes for 2 years for the second year, and then we'll make adjustments after we get the data from this year to be reported next year. So overall, the quality metrics were acceptable, and no recommendation changes from any of the carriers on the dental performance. Again, always want to keep in mind, always want to increase preventative services, especially with children and the younger adults. And the correlation between diabetic care and dental disease is still strong, and want to always keep that in mind and how those 2 items relate. The second item, let me get down there. Again, and we asked Willamette to be a little more disaggregation in their reporting numbers for next year. Appointment availability and satisfaction were generally up across both OEB and PEB on the 3 vendors. We then went on to discuss the CIAO leadership. Didn't take too long. So in the way of that goes, we flip the way we set up the new combined OEB and PEB CIAO work group was that we would change the work group leader each year between OEB and PEB. This year I was the leader, so we moved over to, hold on, I better shut that off. Should put that on silent mode. So Kimberly from the PEB board volunteered to be the leader for CIAO for next year, putting it in the hands of CIAO. And then based on the summer outcomes, we will, I'll be your PEB, or sorry, your OEB vice chair for, or vice co-leader for that from the OEB side for the next year. So that was the leadership change that will occur. And then finally, we had a much longer discussion on this usual CIAO summer research group. We put together, remember 2 years ago, we discussed a few things. One of them being the doula, and then the non-standard healthcare worker. That's not the right phrase, but it's something like that. And then this previous year, we had a work summer research on GLPs, GLP-1 drugs, and remember the summer research is a deep dive into a specific topic to then make a recommendation back to both to the CIAO, to both boards through CIAO on upcoming work. So this year from Mercer, the recommended research will be in cardiometabolic treatment, basically heart disease, in looking at how our coverage addresses the various components of heart disease, which, as Dr. Schweing pointed out, is a very complicated issue because there's so many things that relate and come back to heart disease. And looking at that, one of the key components is basically obesity, leading to type 2 diabetes, which also then is a kind of a relationship to your hyperlipidemia and hypertension, basically your cholesterol levels and your blood pressure work, including coronary artery disease, part of heart disease, and how all these relates together. So there is the research group that was approved to work this summer. We have 2 PEB members and 2 OEB members on that team working with Mercer and staff to research the connection for how to better our coverage for type 2 diabetes, weight management through both pharmaceutical and behavioral modification controls, looking at the different care and treatments and the efficiencies of those cares and how our coverage policy goes along with that. And the other one is, sorry, I missed one, sleep apnea, which again is somewhat related to obesity, or it is related to obesity. Well, it depends on your genetics. Anyhow, looking at sleep apnea as well in part of heart disease. So those are what we approved on, and we will then report back to CIAO, then to both boards on the findings of our current work in cardiometabolic, the deep dive into those diseases. Any questions on what we covered in CIAO this morning? From the board, from staff, from anybody?
Hi, Bill. I have a comment if you don't mind.
Kirsten? Yep.
Yeah, thank you. Yeah, thank you so much, Bill. That was a great recap. We had a really robust discussion too in the CIAO committee because this is such a broad topic with so many complex considerations to think about and lots that we've already talked about and lots that's not within our scope. So where we've landed is within this very broad condition that we call cardiometabolic disorder. There's a couple conditions, specifically type 2 diabetes and overweight and obesity, where we can potentially have a lot of influence through the programs and treatments that we offer. And so the summer research group will be a collaboration to make sure that we have the optimal treatment portfolio in place. We aren't going to be reconsidering topics that we've talked about before in the past. It really is kind of a broad effort to improve the health of our OEB and PEB members. Thanks, Bill.
Okay. Any other comments? All right, we are slightly ahead of schedule, so let's take a break from 2:10 to 2:20, and then we'll close out our last couple issues for the meeting. So let's re-engage at 2:20. Thanks, everybody. Sorry about that. I'm back. Had to finish chewing on my Kind bar. Okay. Okay. Re-engage Maverick. All right. So we are at communication plan with Cindy and Sarah. Cindy and Sarah, are you ready?
I am ready, and I believe Sarah is too.
All right.
Hello. Okay. Hello, everyone. Cindy Bowman. I'm sure you all know me by this point. Sarah and I are going to talk about our open enrollment communications. We gave you a kind of a high-level summary last month and thought we'd go into a little more detail. So Rose, if you could go to the next slide. Thank you. Okay, so we are going to talk a little bit about open enrollment. As you know, it's required this year. So we'll cover the dates and deadlines for the open enrollment communications, talk about some key messages that we've prepared with the help of Mercer. Also the pre-open enrollment webinar, some digital tools, and then we'll give you some information about the normal communications that we provide throughout the year. So next slide, please. Okay, so as I said, open enrollment is required again this year. Last year, as you know, it was passive. Because there are changes and especially because of Garner, and we think that's going to require some extra focus. We've made open enrollment required again this year. So that means that members need to go in and choose their plans during the open enrollment timeframe, which starts for most employers August 15th and concludes by September 15th. Now, there are some employers, as you'll see at the bottom, who use different dates. So we do encourage members to confirm their deadline with their employer so they don't end up late. There are a few entities that wrap up sooner than September 15th, so we don't want people to miss the opportunity. Next slide, please. Okay, so here's just a very high level overview of our dates and deadlines. As you can see, we've marked off what's already completed. So we've gone through the May 8th and May 15th, sending out the initial notices to entities. We've had the insurance committee meeting, and so we're right smack in the middle of the entity decision period. So they're contemplating which plans they're going to offer and selecting those. Come June, we'll do a heads up notice to members and then provide more details in mid-July. And we're going to go into that a little bit later in this presentation. Again, open enrollment period is August to September, and then the benefits effective date is October 1. Next slide, please. Okay, so in mid-May, I'm going to go through just really high level on this, and then Sarah's going to jump in. And Sarah, could you introduce yourself, because I'm not sure everybody knows who you are. And then she's going to cover the things you'll see with red asterisks. That's a hard word to say. Those are our new communications for this year's. So she's going to cover those on the next couple slides. But as you'll see as you go through here, a lot of the same communications we'll do this year. It's kind of the same timeline that we've done in years past. But we have added some information largely because of the Garner component. So Sarah, if you want to jump in and introduce yourself and then go through the new stuff.
Yeah, thanks, Cindy. My name is Sarah Berthume. I'm the communication coordinator for OEB and PEB. And so, yeah, we have some new things in line this open enrollment, as Cindy mentioned. And so you'll see the normal items, but in early June, we are really excited to present a leader admin toolkit to entities, admins, leaders, all the people who might be getting questions from members. And so in this, we'll have talking points, key dates, timelines, and we want to get this to you in early June so that you can get those questions, get ahead of some of the questions that we're already hearing. The next one is a script for the benefits team. We know they're going to be getting the same question over and over, and so we really want to have consistent messaging going out and to make it easy for them, question, here's the answer to that, and they are a unique team, so we know that they have unique communication needs, and we want to really help them with that. We have regular webinars, and we have this new heads up email that we want to send out to members in mid-June. And this would be a high-level email about details about when you'll be getting more details. So we know that folks have lots of questions already coming up, and we don't want them to, have the whole summer feeling like they don't know what's going on. And so we have a heads up email that will give them dates of things that are coming up that they can get more information about, basically the all the other communications you see there on the right under July. So they'll have an idea of when those are coming, and we think that'll be really helpful. Then in July, when we send out the historical sneak peek email, that's what's to expect for open enrollment, we're going to have some specific Garner resources. We know that Garner is creating lots of resources with MODA, but we also want to create our own user guide FAQs and possibly use some of the other videos that they have, just to be sure that we address all of the OEB questions that we know we're getting already in the way that OEB is used to hearing it and hearing from us. So we are excited for that. Then in July, later in July, we are planning a pre-OE webinar, and this would be different than our normal open enrollment webinar. And we'll go over that in a couple of slides, what the details of that would be. But that is in response to all of the requests that we're hearing for more communications earlier, broader, and so that is one way that we wanted to get ahead of that. Next slide, please. Okay, and then we have personalized letters, same as usual, but along with those, we're going to include a Garner flyer for MODA members, giving them a heads up about it. Those mail August 1st. Then we have our other standard OE is coming, open enrollment is here, enroll now. So on August 19th, we do have a planned email to members about Garner, specifically Garner with links to the resources that we already talked about. And then we would have our normal open enrollment is here webinar. Then we'll have reminder emails, post OE letters. October 1st, then we're going to have another focused email going to MODA members with links to the Garner resources. We really want them to have those links ready, available, so they can dig in and start using the tool. Let's see, next slide, please. If there's any questions, just let me know. I think some of that is mostly standard things, but this that we're getting into now, we are really excited about having some key messages this year. We hear from members and board members and staff that, what do we need to tell everyone? And so we want to keep the messaging nice and consistent and plain language, easy to understand. So we are creating these high-level key messages, and basically it's something that you can copy and paste. This will be part of the admin leader toolkit, so you could copy and paste it into emails with different people or different audiences, and you can tweak them a little bit to fit your need, but basically it should be everything that you need to answer all the questions. And we have some samples here, and you can go to the next slide too. We won't have you read them here, but if you would like to have them to review, just reach out to us and we can send those to you. We're still developing them now as we're getting more information. But as according to the timeline, we expect to have that ready early this month. We go to the next slide, please. Okay, so this is the pre-open enrollment webinar agenda, if you will. What we have planned is July 30th, and this is all just kind of still in progress, but what we were thinking is July 30th is ahead of open enrollment actually opening, but also gives us enough time to get the information really hammered down and make sure that we are communicating exactly what members need to know. And we wanted to take a larger runway up to what the changes are this year and why we're having the changes. So we thought we would step back to, you know, healthcare consumerism and how members can work together with us to keep our costs down, and that you know, kind of just what's going on in the healthcare landscape broader than OEB and the state of Oregon. And then we would have the medical vendors come and explain what the plan changes are for their particular plans and what this means to members. And we're planning on this being a live webinar that members could come to and ask questions. So this gives them a chance to get in front of the vendors and get those questions before open enrollment even starts. We'll have a whole section for Garner. We'll have our Garner reps there. We're really hoping to do a demo if everything is set to go by then. So we'll have all that information. As you saw, we'll have tons of links to provide with that. And then we'll go over our well-being programs and do some reminders of those, what's offered. Then we'll record the webinar and we'll post it online. We had thrown around doing series with part 1, part 2, but then we were afraid that members might want to know, you know, what's coming in part 3 and not want to wait. So we're going to do it all together and then post it, and we can even put chapters so you can jump to the place that you're most interested in. But then all this will come back around in August for another, for our regular open enrollment webinar where we have all the vendors and we talk a little bit more high level, but that's a second opportunity for members to talk directly with the vendors. And so we're really excited to be able to give them that opportunity. And next slide, please. Okay, yeah, and so everything is going to be posted on the OEB website, oebinfo.com. And if you just click on the home page, we have the benefit information link there, and just click that and it should take you there, and we'll have all of our open enrollment information and resources, digital tools, the online plan comparison tool, explore your benefits. And if you go to the next slide, we have some pictures of those. So we'll have the highly popular online plan comparison tool where you can customize your own view and compare the plans and features that you want. And then we also have the Explore Your Benefits interactive learning tool that has had a refresh, and we think it looks beautiful. We have won several awards for this communication piece, and we are really proud of it. So we really hope that all members go and check it out for 2026 information. That one will be available July 15th, and the plan comparison tool is available now. Next slide. And these are just some of our other regular benefit communications that we wanted to highlight. We have our monthly newsletter, our monthly learning and events calendar, our wellness guide, and our new hire video. Those are all available at oebinfo.com. And next slide. That's just questions. So if anyone has any questions or would like to know more about what we just went over, we're happy to take them.
Open the floor to the board. Any questions? for Sarah or Cindy? Very thorough. Looks like it's going to be a busy summer. Hopefully everything will roll out smoothly. I'm sure.
Yeah, and just wanted to make one note that I know that everyone has seen that there's lots of communications being created by Garner and Moda and Mercer and OEB, and we are being very careful to coordinate all those communications to not create overwhelm for members. So we're definitely, if you see some things that look like overlap between what Garner may be talking about and what we're talking about here, those are in direct coordination, so they won't be getting the same thing 3 different ways and get overwhelmed about what to look at. So just want to keep that at the top of mind. We're being very sensitive to the balance.
Excellent. All right, seeing no questions or hands up, let's move on to the innovation work group. Margaret, are you with us?
I am here. Yeah, thanks, Bill. Hello, everyone. It's good to be with you today. I'm going to provide a quick update on the innovation workgroup status. There is no written attachment for this, so this will just be a verbal update, but please, I invite you all to ask questions or reach out for any clarifications about any information I share. And I think as most of the board knows, the innovation work group reconvened after being on a bit of a hiatus. The work group met on May 14th. Robert Young and Sally Duerfelt are the OEB representatives to the work group, so really grateful to have their engagement in that. On the PEB side, Kimberly Hendricks and Sean Parkman participate in the innovation work group representing PEB. And in terms of the specific information that was reviewed at last month's meeting, the work group focused on kind of 2 major topics. The first was reviewing health insurance carrier compliance with the OEB and PEB hospital payment cap. And so we looked at initial review of 2 years of data on both 2022 and 2023. The overall finding from the analysis was that carriers' administration of the cap is generally in compliance with the statutory limit in that those capped hospitals are being paid within the 200% of Medicare limit. There are a small percentage of payments that are still under further review to verify that there aren't payments in excess of that 200% limit. And if you'll recall, or if you may not recall, but I'll share that per our administrative rules for OEB and PEB, those rules state that any overpayments in aggregate at a hospital level beyond 200% of Medicare would trigger a return of funds to OEB. So in terms of the timeline, this work is still continuing, that kind of final review of some of the particular claims in question. We expect that'll complete by end of summer, and we'll be providing a final update on that reconciliation to the innovation work group, as well as the board once that's complete in the early fall. In conjunction with doing that, the innovation work group will spend a little time kind of examining the compliance review process. We have a process in place that we use. The administrative rules that we drafted to sort of establish that process are about 6 years old now. So it's always good, I think, practice to kind of just review what our current rules say and what our processes are, and identify any areas that may need updates. So it's possible in the course of doing that the innovation work group may come to the board with some recommended kind of minor adjustments or updates. So certainly more to come there. In terms of the review, generally speaking, it did find, as I mentioned, that payment levels are within the 200% of Medicare cap. However, it did find they have been trending higher in recent years. For example, OEB PEB combined inpatient back in 2021 was down closer to about 150% of Medicare. It is now in the sort of 175, 178% of Medicare range in 2023. And on the outpatient side, the payments run higher relative to Medicare. They had been in the sort of about 180% of Medicare range, and now they're, as of 2023, closer to about 195. So on the outpatient hospital side, certainly getting closer to that 200% of Medicare ceiling. The second topic that the work group spent some time on at the May 14th meeting, again, involved a pretty in-depth review of some pretty technical data, looking at OEB and PEB payment levels across healthcare services as a percentage of Medicare. So this data focused on 2023 OEB and PEB payments, and it looked across all areas of care, so not just hospitals, but sort of what are our reimbursement levels falling at. And so for OEB, overall reimbursement under MOTA plans was in the range of about 187% of Medicare rates in 2023. For Kaiser, that averaged about 192% across all services. However, it was noted in the analysis, if integrated care management fees are included in Kaiser's levels of reimbursement, that puts them above the 200% of Medicare mark in terms of an aggregate reimbursement level for all services. Those integrated care management fees run in the neighborhood of about, can add in the neighborhood of about 20%. And so I think we're doing some additional review with the actuaries and analytical support team from Mercer to really look at those ICM fees and how all of those fees are going into the levels of payment that OEB and PEB are providing. The real purpose of that analysis is to kind of look across all OEB and PEB carriers and identify significant differences in levels of payment for particular areas of service or particular areas where it looks like there may be opportunity. Payments to certain providers, for example, like anesthesia and ambulance, are consistently high as a percent of Medicare, over 300% of Medicare. We've noticed some other types of providers are consistently lower. For example, behavioral health office and physician payments are more in the range of about 115 to 130% of Medicare based on this most recent data. That is an increase above what it had been previously. So I think, the work group is certainly having we'll have further conversations around where we may have opportunities to look at approaches such as site neutral payments or innovative payment strategies to target particular areas of care delivery. Monitoring this level of payment data is kind of a routine function of the work group with the hope of, really better understanding what are aggregate payment levels at and where are there opportunities to perhaps more proactively or more aggressively manage those payment levels. So that's a sort of a lot of data that was reviewed at the May meeting. In terms of looking ahead for the work group, the innovation work group will next convene in September. We expect, we're looking at a schedule with a meeting frequency of about every other month for the remainder of 2025 and 26. I do want to note that when we say every other month, we certainly provide the work group with discretion to hold additional meetings as topics or work might require. Some of the key work plan topics ahead for the work group include a progress review on carriers' value-based payment levels and increases and improvements in reaching value-based payment targets. In the fall, the work group will also review carrier performance on the health plan cost trend and premium trend guarantee, performance guarantee and contracts. That'll be for OEB's 2023-24 contract and PEB's calendar year 2024 contract. We will be looking at opportunities to leverage purchasing power, developing and potentially refining or amending performance guarantees. And then also we expect the work group will be reviewing and developing an approach to review and monitor Garner in terms of member steerage to high performing providers and what how that program is performing. I also want to acknowledge we did receive, and I know several board members who aren't work group members were able to attend the IW meeting, and we always sort of appreciate having that engagement and having people listen in and ask questions when they can. We did have a particular request around wanting to look also at actual service utilization trends. And so we are assessing that on the work plan and kind of figuring where that best resides in terms of whether it would be an analysis for the innovation work group or for CIAO to look at trends in actual service utilization for OEB and PEB members. There had been mentioned during the renewals that there's more higher acuity services being used and things like that. So just wanting to really, dive more deeply into that and see what types of service utilization is actually, how that is actually playing out. And then the last thing I'll mention is that, and I believe Ollie has mentioned this, I believe in the last board meeting, that the PEP board did receive during the renewal season, did receive a letter from the governor's office expressing an interest in engaging with the innovation work group as a venue to identify opportunities and strategies to more proactively manage OEB and PEB cost growth at sustainable levels. So we do expect that as we look in the months ahead, we'll be, working through that engagement with the governor's office and seeking that input to help kind of guide focus areas for the innovation work group. So I will pause there. That's about all I have, but I will certainly be happy to take any questions, or if anyone else who attended the meeting wants to chime in with thoughts, please do so.
Hey, board members, questions for Margaret? All good? All right. Thanks, Margaret. Looks like you guys got a lot of work ahead of you for next year.
Right? Yep. Thank you.
A lot of data coming your way. All right. Next up is Glenn for legislative update.
Thank you, Bill. Well, we're for those who've been kind of watching there, the legislature will be ending its session actually they're aiming for June 19th. Right now, the policy committees have pretty much, they've finished their business. So the Healthcare Committee, Senate Healthcare Committee have finished their business, and really any bills left are either in one of the optional committees, which would be like Ways and Means or Rules, or are awaiting vote within the legislature. For us, we still have some bills that are still alive, but are really in one of these committees. If you can go ahead to the next slide, Rose. 3212, which is a pharmacy bill, is currently in the Rules Committee. That bill there's been some proposed amendments on that, and we're not sure, whether it's going to get the hearing within the Rules Committee, but there has been some recent activity on that bill. 2011, as you see, is dead. We do have some others. Again, 535, which is the IVF bill, is finished. Is in the Rules Committee. And then we do have another pharmacy bill, which did die. You can go to the next slide, Rose. And then we're watching some other priority 2 bills, which are in different forms. Some are awaiting committee hearing, while others are really being voted on with the chambers. Overall, the session, it's been a, kind of a record-setting session. There's been 3,400 bills. PEB and OEB, we're currently still looking at 17 bill priority 2 bills, 21 priority 3, which means we're watching it, but it doesn't have an impact on us. And then about 31 priority 4, which means, that we're watching, but just because of the relating clause. Are there any?
Can you go back to 535?
Sure.
Sally had a question on Senate Bill 535 on what are the potential impacts for us on 535?
Yeah, 535 has a 0.4 for Kaiser and a 1.3 for Moda.
Yeah, how does that? Okay, we were discussing potentially expanding care for IVF or fertility treatment this year, but did not decide to move forward with that. Would that require us to do what we were talking?
What 535, I'm sorry, what that would do is it would require across the board coverage of all fertility treatment. And part of that is IVF, which OEB doesn't cover right now. The other thing about that bill is it requires, it prohibits any limits. And right now, OEB has on its really lifetime limit coverage or lifetime limit on the coverage for its fertility treatment. I believe it's 35,000 right now. You couldn't have that. So you couldn't have these kind of caps on the amount of coverage, be it from a financial standpoint. You couldn't do that with this bill, which would raise the probably raise the impact even. Well, it did raise it even greater. So that was another thing with that bill that would really prevent OEB from managing this in kind of a cost-effective means.
Okay, thank you.
Cheryl, you had a question.
I do. Thank you very much. And so if this does pass, and then we need to be able to support this, I guess what comes along with it, because then our costs go up and we are then in a position to have to figure out, unfortunately, where we're going to either get more money to offset the costs or increase premiums or not offer as much.
Well, I believe it wouldn't take effect till for OEB until October 2026. But when we go to really do the renewals for 2026, it would raise that ceiling of where we start off. So it would make it where we have to look toward other means, such as either really using some type of benefit cuts, some type of subsidy. So it would make our job even harder for reaching the 3.4%. Yes.
Ali, you want to chime in on that?
Yeah, just what Glenn said. I mean, any of these bills with a fiscal impact on premiums would basically eat up part of that 3.4% pie that the board's allocated each year. We make that very clear in our fiscal impact reports, so they understand exactly what situation the boards would be put in should the legislation pass.
Has OHP staff made a comment on this?
They have. You mean Senate SB 535?
Yeah, 535.
Yeah, they have, because under the bill, they are. I believe it applies to Medicaid, and there's also a portion of the bill that also requires HPA to do a whole big study on this. So they do have administrative impact.
They'd have a financial impact as well.
Yeah.
Right. Sally?
Yeah, I have a question. I was on the work group, and she had mentioned that our governor's office was interested in some conversations. I'm curious because in previous, conversations, it came up that there has been legislation that's come across our governor's desk as far as changing the 3.4% cap, and that has been brushed to the side. Is that is her interest in talking to us? Does that also include discussing that, changing that 3.4%? Because I feel like that's one of the
Yeah,
only ways, if this bill were to pass, that we could sustain that coverage without really detrimental coverage impacts.
we had put forth this year, and Ali can chime in here too, a legislative concept to change the 3.4%. There, we gave a number of options, and we had meetings with the governor's office, and they felt that for this year, it really wasn't the proper time to do this change just because of other priorities within the state that they had for this session. But they are very interested in talking about this for the 2027 session, which is really the next time that uh, agencies can put forth bills. So, and Ali, if you wanted to,
Yeah, I mean, both the boards, PEB and OEB boards, supported that legislative concept going forward. Didn't quite make it, past the finish line, but that letter that Margaret mentioned from the governor's office to the innovation work group was kind of a step forward to really. It was really a letter of support to really stand behind the boards and looking at innovative payment methods, leveraging our purchasing power, and that was kind of I think something of a step in lieu of looking at that legislative concept this session. So yeah, that's definitely in the future.
Yeah, I mean, I think that if that bill passes, that it's appropriate that prior to the implementation of that we're really able to have a conversation with her and just really encourage that conversation, about changing that 3.4, because like I said, I don't see how we could implement that without, just devastating coverage changes.
sure.
And while I think it's a great, I'm not opposed to expanding fertility coverage. We've got to be realistic and make other changes appropriate with that.
No, and those are very good points. And as Ali said, we make those every time we, respond on these different pieces of legislation. For 535 and really anything in Ways and Means that has a price sticker to it. At this point with the legislature, and it, you can never say never, but we have not seen, say for 535, it's never had a public hearing yet with rules. And if it had a public hearing and then they had the work session and for whatever reason it passed out of there, it would still need to go to Ways and Means and then they would have to look at it. And something with this size of a impact, it would be very doubtful that it would make it through Ways and Means because the legislature this year, they have less money to work with. So there is a lot of extra scrutiny at Ways and Means on bills, especially new things that are outside really, I would say the core services that have a price tag. So it's yeah, like I said, we won't. I mean, these committees can, House rules, Senate rules can live till almost near the end of the session, but they are really kind of running out of time on that.
Thank you for all that. I appreciate that information.
Mm-hmm. Sure.
Any other comments from the board for Glenn? All right, seeing no hands up, let's move on. So I'm going to for logistics purposes, flip the order of the last two items. So we are going to do public comment right now. So you should have seen 3 public comments in your packet, 3 letters that were addressed to the OEB board on GLP-1, board from the Board of Obesity, from a PEB member on GLP-1, one from the American Board of Obesity Medicine, and one from PILMA. Rose, do we have any other public comment that has come in?
No, no public comment other than that.
All right, everybody from the board should have received the 3 letters that were addressed to us. If you haven't, raise your hand now. Otherwise, I'll close public comment. Okay, I don't see any hands up. So now we'll go to the final agenda item, which is the election of the board and board chair and vice chair for the upcoming year, 26-27. So as Ali mentioned, in the May board meeting, the June board meeting now, will conclude by conducting the election of officers where we elect our next board chair and vice chair. As referenced in the OEB board bylaws, the board will elect and reaffirm the chair and vice chair each year no later than the month of August. So that's now because we don't have a July meeting. Terms of office will be structured such that after serving as vice chair, the vice chair will move into the office of chair. That means that Enrique Ferreira will, as vice chair now, will move into the OEB board chair. So we will now be voting to elect a new vice chair. As referenced in the representation among officers section of the bylaws, it is structured that the chair and vice chair officers are filled by representatives from different stakeholder constituencies. The board will elect the chair and vice chair from a slate of eligible candidates. Since Enrique is in a labor seat, eligible candidates for the vice chair must be from the state management, health policy, or district board representatives. That slate would include Cheryl Berger, Dr. Andrea Laura, Bonnie Losi, Tony Mann, and Misty Wharton. Ali and the board leadership have asked interested candidates to contact Ali prior to this meeting, and it sounds like Dr. Laura has indicated an interest to fill that role. If there is no one else from the list who would like to put their name forward, well, let me just ask, is there anybody from that list who would like to put their name forward as an interest in being the vice chair for the upcoming 2025-26? If so, raise your hand or speak up. I'm kind of hearing crickets. So, Dr. Laura, you have expressed that interest. So I'd like to request a motion to nominate Dr. Laura as OEB Vice Chair. Anybody? Robert? I see Robert making the motion.
Yes, I would love to nominate Dr. Andrea Laura as the Vice Chair for the upcoming year.
I'll second. Bonnie.
Okay. Bonnie seconds that. All right. I will do a roll call vote as this is kind of a thing. So Robert, that's an aye, right? Obviously.
Yes, correct. Aye.
Misty is absent today. Susan Miller, are you there?
Oh.
Was that an aye I heard?
Yes, aye.
Yeah. Okay, and Tony is absent. Bonnie?
Yes.
Dr. Laura?
Can I vote for myself?
Yes, you can. You're a board member.
Yes.
I would expect no other answer, I hope. Sally?
Yes.
Michelle?
Yes.
Cheryl?
Yes.
Enrique?
Yes.
And current chair votes for. All right. Before I turn the gavel over to Enrique, let me first make a comment that I have been politely, cordially, and all those very nice words asked to apply for one of the open seats on the OEB board, as my seat is closing out with for me. So there are some open seats, and I have decided to accept that and have submitted an application to be considered by the governor's office for nomination for one of the other seats on the OEB board. So we'll see how that nomination process goes throughout the summer. And I may be rejoining you with a different hat on, but still me, and in September. Also, before I turn it over, I'm going to ask Ali for any comments for the ending meeting of the fiscal year.
Yeah, thanks, Bill. And I just want to say a few nice things, Bill. Hopefully, we'll be able to continue our working with him. But from day one, Bill has just really shown a true devotion to OEB members, and he's always really looked out for members from every part of the state. And I really do think that's really strengthened OEB's credibility around the state. Bill has always attended CL meetings, even when he wasn't on the work group, and that was when it was in person. So he would actually travel to Salem to attend those meetings. And I think those that have known Bill for a while know that he's a really creative thinker. He's always really pursued innovative solutions to problems that the board has faced over the years. And he's really contributed to OEB's earning a reputation as a healthcare innovator. And, OEB was one of the first large groups with school districts, multiple educational entities in a large group around the nation. So it really takes board members like Bill to solve problems where there's no precedent that exists. And again, we really do hope to continue this, Bill, but it's just been a real pleasure, and I couldn't let you go without saying a few nice things about you. So, and we're super excited for Enrique to continue and jump into the chair role, and Dr. Laura to have as vice chair. We couldn't be more pleased for that. So look forward to the fall.
Thanks, Ali, for those kind words, and for the board. Regardless of what happens this summer with my application, I've really had a good time. It's been a very educational and very, I was honored to serve on this board. I really enjoyed my time with it, and I hope to continue. Okay, with that all said, I would like to formally hand the virtual gavel off to Enrique as the new board chair to close this meeting.
Thank you, Bill, and good afternoon, everybody, and good luck to you, Bill. I'm sure we'll see you around soon. Continue to collaborate with us and work as we continue to expand and work for benefit our members from all over the state. And thank you to the staff today for the presentations and the information. I know some of you have a busy summer with committees that Bill mentioned earlier on the CL meeting that happened. And always stay in touch with all of you. I'll meet with our new vice chair. Congratulations, Dr. Lara. And we'll see more emails from Rose to stay updated in our calendars, which we all look forward to in the fall to meet. But also, if anything that comes up, I'm sure Ali will keep us posted during the summer and during this legislative session that's about to end this month. So on my behalf, thank you, and enjoy your summer. We'll see you all soon.
Thank you so much.
Thank you, Bill. Thank you, Enrique. See you later.
See ya. Bye, Bonnie.